Hello, I'm Ian Murray, Capital and Estates Programme Manager.
And I'm Erin Marshall, Capital and Estates Improvement and Development Manager.
DCHS Estates team is over 50 strong. We have colleagues based all over the county. We look after over 150 buildings, including GP surgeries. We have 70 grounds and garden sites that we maintain, and we serve a population and clients of over 7,000. Since 2013, DCHS has been responsible for maintaining and developing a wide portfolio of estate across Derbyshire, much of which was transferred to DCHS from the previous PCTs. The buildings vary in age and condition, ranging from old workhouses dating back to the 1840s to newer Lifco buildings. Our estates department ensure the safe and efficient operation of the Trust's buildings, engineering systems and vital patient equipment, and is responsible for maintaining buildings to the highest possible standards. We've gained a reputation for providing a quality service and are proud to be one of the few NHS estates departments nationally to have BSI ISO accreditation for quality and environmental management. Our service is also recognised within DCHS and by system partners as being responsive in unexpected events, supporting sites in the event of floods, leaks, and responding to break-ins and accidental damage, and the occasional car versus building incident. The estates team were also pivotal in setting up COVID vaccination hubs across Derbyshire in 2021, transforming buildings such as theatres, community halls and sporting venues into mass vaccination centres, enabling the rapid rollout of the vaccination programme. NHS Estate is one of the key enablers to change in the healthcare system, and good quality fit-for-purpose facilities and equipment are essential for the delivery of high-quality care to patients. Developing community care estate is critical to enabling integrated care systems to provide more out-of-hospital care closer to patients' home, and this requires careful strategic planning with system partners and proper investment in the estate. Our estate strategy sets out a 5-year plan for managing our buildings and the aim of aligning our estate with service objectives so we can provide the right facilities in the right place at the right time. It also helps us to answer questions such as where is capital funding required and how can we minimise backlog maintenance or running costs.
So we use a tool called a 6-facet survey to assess the condition, quality and functional suitability of our buildings. And this helps us to identify backlog maintenance costs and identify buildings that are no longer fit for purpose. And this forms the basis of our capital plan.
A simplified definition of capital is expenditure of at least £5,000 for long-term investment in buildings and maintaining NHS land, facilities and equipment. Across the NHS, capital investment accounts for a small share of the total health spending. Despite low levels of capital funding over many years, DCHS has maintained a robust capital programme and significantly invested in our estate.
A good example where 6-facet survey findings, strategic estate planning and capital investment can be seen in action is the development of our estate in Heanor, where we owned a hospital and a health centre, both requiring significant backlog investment. DCHS invested £3.4 million in a new health centre on the site of the former hospital and gained a capital receipt for the sale of the Heanor Clinic site.
In recent years, there have been opportunities to access national capital funds to support system estate priorities. Babington Hospital in Belper and New Home Hospital in Bakewell, both former workhouses dating back to the 1800s, have significant maintenance needs, outdated infrastructure systems and challenging listed building status. DCHS have successfully bid for £14.92 million STP funding to replace the existing facilities with new buildings to the value of £26 million. New Home Health Centre incorporating Bakewell Ambulance Station is due to open to the public in September this year, and we are about to commence work on a new health centre on the site of the former clinic in Belper, which is due for completion in early 2026. Unfortunately, our bids for national funding for a much needed development in Buxton have so far been unsuccessful, We continue to work with system partners and to explore funding opportunities to be able to continue with our plans for new development in this town.
So in parallel with our estate strategy and capital investment plans, we also continue to review how we're using our estate. Since February 2023, DCHS have used room occupancy sensors to gather information about how clinical and office space is used during the day. And the findings of the surveys, along with data from our Planet FM system, are enabling our site optimisation group to identify opportunities for improving utilisation, driving efficiencies and exploring different ways of working.
As DCHS has a significant property portfolio across Derbyshire, we've been able to work with system partners to optimise the use of the estate and increase access to services such as diagnostics. Joined Up Care Derbyshire has received funding to develop 3 community diagnostic centres at Whitworth, Ilkeston and Walton hospitals, increasing capacity and improving our local access to a range of diagnostic services, making it quicker and easier to get a diagnosis. Since the 2020 introduction of capital spending limits and funds shared with partner organisations, DCHS has had less flexibility than we would have previously afforded as an NHS Foundation Trust, and this, along with challenging approvals process, will continue to be significant barriers to capital investment for DCHS. But we remain committed to improving, developing and rationalising our estate within the current financial constraints that we are facing.
However, despite these constraints, we've had much to celebrate in recent weeks, with the turf cutting at Belper and the keys handover at Bakewell, marking major milestones in 2 big developments which will future-proof health services for local residents for years to come.